Welcome, everybody. My name is Chiquita Paula de Souza. I'm one of the education chairs on the executive committee of the section on global health. I'd like to introduce you to the webinar series. This is the 7th in the AAP Global COVID series developed to address unique issues that global health practitioners are facing in the time of COVID. The AAP and the AAP section on global health are happy to bring you today's webinar in partnership with the UMID Childhood Development Center and Conrad and Hilton Foundation. Our speakers will delve into the impact of the ongoing pandemic on early childhood development programs, providers, and caregivers, and on children themselves. We have no conflicts of interest to disclose, and please note that opinions expressed today are representative of our speakers' own personal experiences, not AAP official policy. A few housekeeping issues before I turn it over to today's moderator, Dr. Fan Tate, who is the Chief Medical Officer at the AAP and the Chair of the AAP's Global Early Childhood Development Project Advisory Committee. If you have any questions for the panelists, please use the Q&A box to submit. Do not use the chat box so we don't miss any of your questions. Questions will be addressed after all the panelists have concluded their presentations. And if you are tweeting, please use the hashtag AAP Global COVID Series. I also would like to, for the first time this year, the NCE registration, the NCE registration is going to, the NCE is going to be virtual, and it'll be hosted on October 3rd to the 5th. We will missing many of your faces in person, but hope you'll be able to join us online. We're going to have 35 live sessions with 150 on-demand sessions and a virtual poster hall for abstracts. And happy to note that the on-demand sessions will be available online on demand through January 2021. Registration is now open at the www.aapexperience.org. And wanted to ask you all to save the date for our next webinar in this series, which is Health Education During the Pandemic, Tips for Trainees and Educators on Optimizing Global Health Education from Their Homes, which will be on September 15th at 9 a.m. Eastern Time. So without further ado, I'd like to hand over to you, Dr. Tate. Thank you.
Thank you so much. Thanks, Dr. Paula de Souza. I'm so pleased to be here with you all. Thank you for joining us. I'm a pediatric neurologist, and so you can imagine how excited I am about this particular webinar. I'm like you all, I'm acutely aware of the importance of supporting really healthy brain development, and especially in the face of adversity. There's no more effective way to promote lifelong health than to focus during the earliest and most formative years of development. You all know this, but before COVID, some studies talk about 250 million children in low and middle income countries have been unable to meet their full developmental potential through no fault of their own or their families at all. Now more than ever, we need to pay attention to the environments in which our children, where they live, where they play, where they learn, where they interact, to support healthy development. And not just development, but their physical health, their socio-emotional health, their school achievement. And when we think about neurology and the brain, we're talking in terms of executive functioning. Our speakers today will talk about the impact of COVID on ECD programs and services, and really giving special attention today to promoting play in this environment in which we all are living. We've asked them to share their experiences on how their respective organizations have worked to adapt programs and find solutions to ensure children's development continues to be supportive. And I will just tell you, we are so lucky to have 4 of the leaders in early childhood development and nurturing care join us today. So let me introduce the first speaker. First speaker is Dr. Jill Popp. who is senior researcher at the LEGO Foundation, where she focuses on building evidence on learning through play, whole child development, and lifelong learning, too. Jill will help us set the stage and share insights from the LEGO Foundation. Jill?
Great. Hello, everyone from Denmark. I'm pleased to be able to join this webinar this afternoon and present the LEGO Foundation's response to the COVID-19 pandemic. Next slide. The LEGO Foundation is a Danish foundation that aims to redefine play and reimagine learning. We work with partners across the globe to implement programs that make children's lives better. Together, we seek to ensure that the fundamental value of play is understood, embraced, and acted upon. We do this by putting early childhood development and quality education on the global agenda in order to make playful learning a reality. Next slide. So, as you can imagine, we get asked all the time, what is play? And a few years ago, we developed characteristics of playful learning experiences. And using a robust evidence base, we can identify that learning through play experiences have 5 characteristics. They're joyful, they're actively engaging, they're iterative, they are meaningful, and socially interactive. We recognize that all 5 are not necessary at the same time, but a playful mindset is fostered when these characteristics are present in an activity. We believe, we believe that these characteristics support children's holistic development and future skills that are necessary for success in a changing world. Next slide. In March, the LEGO Foundation and the LEGO Group announced a $50 million donation to support children in need during the pandemic to ensure that they continue to have access to learning through play, to help them achieve lifelong skills and strengthen their resilience when going through these difficult times. Next slide. The Foundation developed different action streams to help us quickly program our $50 million commitment. In doing this, we wanted to create a way to be immediately responsive to the needs, to stand alongside our partners who were facing unprecedented constraints, to leverage our own heritage and body of work, to give attention to vulnerable populations, to help systems build back better, and to use this moment to promote the transformational thinking we think learners so urgently deserve. It has led to 4 different work streams that you can see on the screen, and I'll go through them in the next slides. Next slide. Our first area of response, the LEGO Foundation joined forces with the LEGO Group to start a Learning Through Play campaign. The objective of the campaign is to support our audience with fun, easy, learning through play activities to engage children at home. Along with pushing out messaging and activities with our partners across many platforms, we developed a playlist which you can find on our website, which is a highly curated, regularly updated digital library of learning through play activities across the developmental spectrum, and making it available to everyone. Next slide. Next, the Foundation has partnered again with the LEGO Group to give out more than 70 small grants to actors working in the community level in 20 different countries. These grants are helping on a variety of basic needs, supporting crisis centers, enhancing education and learning, and providing mental health and psychosocial support services using learning through play. Next slide. Through another work stream, we are supporting Foundation partners to preserve their operational capacity. And this is mostly for partners that are existing partners of ours that you can see on the screen. And this was really to enable them to pivot and respond to the crisis with learning through play. We've distributed more than $30 million to over 20 of our existing partners for their emergency response. And a lot of this, as I said, was related to operational costs, but also how to pivot their work. For example, working in person with practitioners and children, early childhood development centers, to taking that work virtual and how to do that in an impactful way. Next slide. As we know, the reality has changed for many, and it's urgent to understand how distance learning methods and tools can promote continuity of learning for children. Our distance learning response investigates and promotes solutions that can be used in a wide range of situations. Our goal is to help sort through and sift through the different evidence that is out there and scale what is working quickly to support greater access for learners and to enable systems to develop more strongly. Next slide. In addition to our special funding, we've had to work along with our partners to rescope various timelines and deliverables and different activities that they were doing. And as you can imagine, there's still a lot of uncertainty with all of this. And so it means routine checking in with our grantees to understand the work that they're doing and things that are changing very rapidly. Next slide. This is just a snapshot of breadth of experiences of a few of the grantees in our teacher professional development portfolio. Prior to COVID, all of the grantees were completing their inception phase, meaning that they were developing certain plans for the projects that they're supporting. We were working at a national scale. A few were starting at a subnational level with the intention of building, testing, and learning their way into a national implementation. This slide illustrates what happened when the pandemic showed up, the various creative videos, telecounseling, radio instruction, formative studies, and back-to-school campaigns that needed to be implemented. Next slide. As you can imagine, along the way, we've tried internally to really learn from this experience and from this unprecedented time. And so we're just 5 months into our response, but we have some reflections that I'd like to share with you. First, we have found it paramount to take time to listen and co-create with our partners and to strengthen our efficacy as a donor. Second, we have actively decided this is a moment to try big ideas, even if they fail. And that has been extremely motivating for all of us at the Foundation. Next slide. Third, we have financial resources at the Foundation, but also the power to convene, to leverage major global brands, to persuade other donors, and to use the incredible evidence, creativity, and experiences to offer in a time of need. Fourth, there's urgency in the moment. And one thing that we've heard across our partners and internal colleagues and external colleagues is that things can really happen quick if we put our mind to it. And so I think that that's been a really important learning, hopefully that extends beyond this crisis. And finally, there's no one answer, no one question. The problems and solutions look vastly different depending on how one approaches this pandemic. And so again, this sort of circles back to really listening to our partners and the needs and concerns that they have as well. Next slide. Yeah, and that's it. You can certainly get to know us better from our website and different social media platforms as well. It's certainly been a pleasure to share our work with you, and I look forward to future conversations. Please stay safe and play well. Thank you.
Thank you. Thank you so much, Jill. I love what you all are doing. I love your presentation. When I love the holistic development, but I also love your reflection. I think that we have to learn together through all of this, and that partnership and learning from the pandemic, I think, is critical as we all move forward together. I'll just say one other thing. Thank you, Jill, for reminding us that play is not frivolous, right? It enhances brain structure and function and promotes executive function. We know those. It's really wonderful to hear how LEGO has transitioned during this time of COVID. Well done, and thank you.
Thank you.
Okay. All right. So next we have Dr. Rupa Shrivastava, a fellow pediatrician. Thanks, Rupa, and the director of developmental pediatrics and head of clinical service at the Umeed Child Development Center. Dr. Rupa will focus on how Umeed has adapted clinical services to support children living with developmental disabilities during this pandemic. Rupa, thank you so much. It's been my privilege over the years as a neurologist to work with children and youth and families with developmental disabilities, and I can't wait to hear your presentation. Thank you.
Thank you, Dr. Tate. Good morning to all of you, and good evening to those who are joining from my part of the world. It's indeed a pleasure to be here today and to have the opportunity to share the India experience on promoting early childhood development in the time of COVID-19. And before I start, a word about the organization I represent. Emily, can I request you to move the slide, please? Thank you. So Umeed in Hindi, which is our national language, means hope. So Umeed Child Development Center is a not-for-profit organization in Mumbai, and we work with children with disabilities. And our work is spread across 4 verticals: clinical services, through which we directly provide services to children with disabilities and their families. Our training vertical, Emily, you can advance the slide, please. Our training vertical, through which we train caregivers, professionals, community health workers. Our research vertical, through which we track the impact and outcomes of the activities in the first 2 verticals. And awareness and advocacy that strives to provide a platform to children with disabilities and their caregivers so that their voices can inform and influence practice and policies in our setting. Next slide, please. So over the course of the next 10 minutes, I'll talk about the impact of COVID-19 on ECD programs in India, some of the challenges that we've faced, and potential solutions as we are discovering them. Next slide, please. So before I even get started on ECD programs, it's pertinent to talk about the larger context and who has access to children in the early years in our context. So unlike in the Western context and in high-income countries, very few children in our region have access to pediatricians. Many of them are accessed by community health workers or Anganwadi workers or courtyard workers, as we call them, through national level programs like the ones of early childhood development promotion, nutrition, maternal and child health immunization, etc. Of course, in a country with our size and challenges at this point, gaps are to be addressed in policy and implementation, and that's where the not-for-profits and the for-profits step in to plug some of these gaps. Next slide, please. Emily, could you advance the slide? Thank you. So with the onset of the pandemic, of course, overnight, what ended up happening was the community workers who were working in the space of ECD promotion had to redirect their efforts to COVID-related activities. Not-for-profits had to step in to address food security concerns when that was not their primary mandate. And in fact, at a time when they were intensely distressed themselves because of funding cuts. So we anticipate that in the next year to 3 years, there would be around 30 to 60% funding cuts, and many of the not-for-profits actually face a risk of being completely shut down. So in such a scenario, caregivers become the first and the only responders to children in the early years in our context. Next slide, please. So we know that early childhood development exists across a continuum, and for children to develop optimally, it's important to promote protective factors and to mitigate risk factors. And as you will see in the next slide, the COVID pandemic actually magnified some of the pre-existing risk factors. Emily, could you move on to the next slide? Thanks. So poverty and food security issues became much more magnified because of unemployment and loss of wages. There was increased domestic violence because children and families were cooped up in really small spaces, and also children faced an increased risk of sexual abuse. And it was no wonder then that caregivers were facing intense distress and mental health concerns in these times. And if that was the case with caregivers, next slide, please. The providers who were at the front line, who were interacting with families, were equally distressed and overwhelmed. I'm going to request you to zoom in with me as I talk about services that are provided by our organization over here. And on your screen, you see two pictures. On the right side, or in the middle of your screen rather, you see a group of extremely qualified and skilled professionals in the space of ECD, mental health, disability intervention, and this is the staff that rolls out our center-based services. On the left side of your screen, you see a mature community health worker who's a trusted individual from the community, whose education background is probably up to a high school level, who's been trained in ECD promotion activities. Now, for both these sets of providers, life changed overnight. Their service delivery model had to pivot overnight, and they had to provide services in the face of these magnified risks and in a milieu where there was huge inequality in resources, especially resources like internet, which was the one single thread that helped us connect with caregivers. Next slide. So it actually became really, really imperative for us to step back and take care of the mental health of our providers. And what we did was a series of discussions and workshops, next slide, with our providers, where we focused on little things that providers could do to take care of their own mental health and that of their loved ones at home. And in fact, this really proved effective for our community health workers because they shared the same context as the caregivers, and some of the issues that they were experiencing, some of the challenges that they were experiencing were very similar to what the caregivers were facing themselves, and they could relate to that. So as the providers reached out to support the mental health of the caregivers, next slide, we supplemented their efforts by providing them with resources like this is a screenshot of a video that we had created for taking care of your mental health for our local context. And on the right side, you see a screenshot of a booklet that was co-created with caregivers, which has strategies and hacks for how to take care of your mental health in ways that make sense to our context. Next slide, please. So we also diversified the ways in which we provided mental health support to caregivers. So earlier on, caregivers would visit our center and meet us face-to-face for an hour-long session. That was no longer possible. That was a luxury. Caregivers were caught up with household chores. They did not have the freedom to talk to mental health providers, and they were experiencing distress. So we used check-in calls as a segue to keep in touch with them and to reassure them about our availability should they need it. We also connected caregivers in pairs, in small groups, so that they could exchange strategies and solutions with each other. And we organized fun activities such as a poetry afternoon or a baking workshop or a singing session over video conferencing and WhatsApp chats that helped caregivers think about things other than the serious issues at hand. Next slide. We also continued to work with our children, both at our center and in the community. Next slide. And we did this through individual sessions. We offered group training sessions for caregivers where we supported them in promoting child development in these distressing times and organized fun clubs for children where the sole agenda was just to have fun and connect with peers. Next slide. Our early intervention center that helps children get ready for preschool, especially children between the ages of 2 to 6 years, also had to pivot overnight and change its model. Next slide. So much of the curriculum had to be adapted for online delivery. And I have a short video clip. Unfortunately, I can't play the audio for you over here, but which will give you a sense of an interview that a caregiver is part of with the Early Intervention Center's teacher, where she's actually administering a standardized tool, which involves a parent interview. And you'll see over here, can you play the video, please, Emily? This is little Krishna. He's 2 years old. He has cerebral palsy, and he is now being enrolled in the Early Intervention Center. And you see the Early Intervention Center teacher asking an open-ended question about how Krishna connects with adults at home. And she's inquiring about social skills And you see the mother talking about what happens at home and how Krishna connects with other adults at home. The responses of the parents are coded on milestones that exist on this questionnaire. It's called the Guide for Monitoring Child Development, that focuses on rapport building between the caregiver and the care provider and uses a strengths-based approach. And you see I'm going to ask you to pause the video and advance the slide for me over here. It's a shame that the audio didn't play, but you'd have got a sense of the rapport that existed between the caregiver and provider over here. In fact, it was exactly this rapport that helped us even in our community context, where on the left side, you see this little boy. His mother had last seen a community health worker when he was 9 to 10 months of age. And 3 months into lockdown, she was concerned about the fact that he wasn't walking yet. And because there was a relationship of trust with this community health worker, she could reach out to her and ask for help. And the community health worker, for her part, had access to evidence-based strategies that were locally adapted, was available in local languages, and she could use those to support the caregiver in her efforts to promote this child's development. On the right side of your screen, you see this mother and child playing in an outdoor space. This is a rarity in urban slums in Mumbai. And a particular community was really resourceful and created a pact that they would take turns to share this very limited outdoor space that was available, so that each of their children could take turns and play outdoors without jeopardizing each other's health. So in a nutshell, yes, this time has been extremely distressing. It's been really painful on many fronts, but there have also been little stories of hope, little stories of generosity that have kept all of us going. And on that note, I want to end the presentation and would be happy to take questions at the end of the discussion.
Dr. you may be muted.
Sorry, I'll start again. Thank you. Thank you, Dr. Srinivasan, for a great presentation and for specifically highlighting the importance of supporting the mental health of both health providers and caregivers so that we can all promote our children's well-being. It's my privilege to work with wellness here at the Academy, and how critical it is, particularly during this time of COVID. So thank you. I also love what Uman means, which is hope. And I wrote down as you were presenting, I love on the first slide, the inclusive world where all children reach their full potential. Thank you so much for working on that with all of us. Okay. So we'll shift to our next presenter. So children in refugee and humanitarian settings are dealing with a myriad of challenges, and they were before COVID, and they are now with COVID. And next, we'll be joined by Deborah Rodriguez-Garcia, Education Manager of Humanitarian Programs at Sesame Workshop, to hear how Sesame has worked to adjust its offerings so it can continue to promote ECD and safe play in places where social distancing and sanitation may not be possible, or sanitation may be lacking. So Deborah, I'll turn it over to you now. Thank you.
Thank you very much for that kind introduction, and thank you all for having me here. I'm very excited to share with you all Sesame's response to COVID-19. I'll start with a little introduction of Sesame. Sesame Street is watched in more than 150 countries, reaching an international audience of 156 million children around the world. So truly making it the longest street in the world. Next slide, please. Our mission is to help children grow smarter, stronger, and kinder. And this is integrated into all the content that we create to support Sesame's programs. Thank you. Our development process is rather extensive. We typically start with a needs assessment, carry out multiple seminars before we set our educational objectives, which steer our production and supports our formative research. We then work out our distribution channels and conduct evaluations post-distribution. Traditionally, we also have multiple distribution approaches. There's a lot of familiarity with our television programs, but we also offer content on mobile devices, through our websites, and through our direct services in partnership with various organizations on the ground. Of course, because of the COVID-19 pandemic, we've had to reassess our development and distribution processes. We essentially had to fast track our development process by creating immediate response content, which are directed to our global audiences in parallel to the creation of a framework in response to the urgency of the situation. We also had to reassess the best platforms for distributing the information to children and caregivers with the restrictions and circumstances in mind. With that in mind, we had to place a heavy emphasis on digital distribution. We've also placed a heavy emphasis on making sure that caregivers are empowered and engaged in their children's well-being and learning. With the support of global advisors, we developed a strategic international social impact framework. Our topics are child-facing objectives involve the general health information, so making sure that children are able to practice good health behaviors. We also wanted to make sure that we extended on this knowledge by having COVID-specific information shared in a child-friendly way. We recognize that the circumstances behind this pandemic have brought out quite a bit of social-emotional challenges, and wanted to make sure that children are equipped with coping techniques. And we also recognize the challenges in children accessing education with the restrictions in place, so making sure that children have access to playful learning opportunities from their homes, and also highlighting child protection messages. This is an example of one of our global-facing assets for children, which is a really fun video PSA featuring Elmo washing his hands in a video that is very catchy and was made available in over 20 languages. I won't play the video, but I do strongly recommend that you go onto our YouTube channel and watch it. You won't be able to get the song out of your head. And the objective was to create catchy content that would support children's hand washing practices and make a significant impact on promoting the health content. We also know that it's critical to have objective space for our caregivers. So we wanted to also equip the caregivers with relevant health knowledge and make sure that they are up to speed on what COVID-19 means and the appropriate practices in place to support their well-being and the well-being of their family. We also recognize that the pandemic puts a strain on the families and the caregivers in particular. So making sure that there are techniques for helping caregivers cope, as well as helping them adjust their ability to support their children's coping skills. We wanted to place an emphasis on making sure caregivers are empowered with their understanding of play in early childhood development, and give them the tools that they need to support their children's learning through play, particularly within the home setting. And we also wanted to make sure that caregivers were equipped with messages that support child protection objectives. So this is a sample of our caregiver-facing content. As you can see, there's a bit more detail placed in the caregiver content but we wanted to make sure that whatever we present is practical for the caregivers and is also accessible. So we have things that are tailored to caregivers of lower literacy levels that are heavy on illustrations. We also use platforms that are accessible to caregivers, such as WhatsApp, to give them the tools that they need to help themselves and to help their families. One of our biggest productions for our COVID response is a new family co-viewing special titled Elmo's World News, and this was done through funding from the Lego Foundation. Elmo's World News highlights diverse play experiences through a fun adventure with Elmo and his friends serving as news reporters and showing their ways of adapting to their new reality by finding interesting and fun ways to play indoors in closed spaces. We also have relevant COVID-19 messages in there, and we have strategies for coping and dealing with stress, as well as highlighting the need for parental engagement. And this was designed with the intent for families to watch together with their children. Okay. For our humanitarian specific response, through our Play to Learn project, we are developing COVID-19 messages specific for Cox's Bazar, recognizing that a lot of the audiences in the refugee camp don't have access to online resources or to television broadcasts. We've had to pivot and are using radio messages to deliver PSAs about COVID-19 and the importance of play, and again, delivering practical tips for emotional and mental well-being. These same messages are highlighted in illustrated posters that are going to be shared in public spaces throughout the camp. And we are also developing a child-facing storybook that specifically talks about hand washing and COVID-19 and mask usage, and it's fully tailored to represent the population within Cox's Bazar. In the Middle East, through our partnership with IRC under Aklan Simpson, we are disseminating awareness messages again through WhatsApp and facilitating communication between caregivers and IRC's facilitators. We are also using scripted phone calls to disseminate health-related messages through the health and protection sector. Some of our newest developments, again, targeting our humanitarian audiences, are through partnerships with USAID's Asia Bureau, UNICEF, and a partnership with Unilever. And all of these are directed at creating content that's specific to the countries highlighted within the grants that we are partnering under to extend our response efforts. I highly encourage you all to reach out by visiting Sesame's website, sesame.org/caring, for our Caring for Each Other content, and also check out what we have available on our YouTube channels. Thank you very much for allowing me to present today, and I wish you all the best.
Thank you. Thank you so much, Deborah, for your presentation. It was great, wonderful. I love so many things, smarter, stronger, kinder, but the educational framework and the humanitarian response, absolutely wonderful. Thank you for giving us really a glimpse of how families and children are engaging with your offerings in different settings. Okay, to round out our panel, I'd like to welcome Lisa Bomer, Senior Program Officer of International Programs at the Conrad N. Hilton Foundation. Lisa will share ways the Hilton Foundation is supporting its in-country partners' urgent needs posed by COVID, while also continuing to build its ECD programs. Thank you, Lisa.
Great, thanks so much. It's wonderful to be together with you all. I'm going to build on the great comments my fellow panelists have made. Apologies, I don't have an attractive visual deck to accompany my comments, but hope it'll be compelling nonetheless. Just taking us back to April 13th, when the United Nations distributed a policy brief analyzing the impact of COVID-19 on children and stating that children are not the face of this pandemic, but they risk being among its biggest victims. And I know over the past weeks and months, we've all had very heavy hearts as we've witnessed the avalanche of negative impacts that have fallen mostly on the poor and least advantaged members of our communities everywhere, heavily impacting young children and their caregivers. And I'd like to briefly share with you how the Hilton Foundation has responded and a few of our reflections to date. I lead one of 6 strategic initiatives at the Foundation that are international as well as US focused. And the work that I lead is focused on supporting nurturing care in 5 countries in East and Southern Africa via efforts to improve caregiving, strengthen community-based organizations and government health systems, and build evidence. Very early on in March, as we were all locking down, the Foundation made rapid grants to the WHO and to UNICEF for the pandemic public health response support to African governments. At the same time, within our ECD initiative, we reached out to partners to signal our support for their work to integrate parenting and COVID support. And we've been impressed by how rapidly and creatively partners have been able to respond. I think we've heard on this panel some fantastic examples. And I think this holds true for the entire early childhood field. That's really stepped up. For our ECD work, again in East and Southern Africa, the Hilton Foundation's received $3 million extra for this year on top of our regular grant-making budget that's just over $11 million or so. Foundation-wide, again across all our initiatives, we've allocated $19.5 million in extra COVID support to date. And we think that by the end of the year, our total COVID-specific support will be $22 million. Our board's been very supportive of efforts to provide flexibility to partners, and we've heard some examples on the panel. We've ensured that partners can continue to pay key staff, even when activities have had to be put on hold given social distancing restrictions, to extend project and reporting timelines, and modify project targets where needed, to change modalities, and again, great examples have just been provided, using the media, moving group meetings to home visiting, et cetera, depending on government guidelines. And then we've heard some great examples as well around all the efforts to integrate COVID-19 as part of parenting and nurturing care programming, utilizing formats such as radio and small groups. We've also really focused on providing PPE, hand washing, and hygiene support to communities, childcare centers, and health facilities because we found that our partners really were looked to by government and communities to really step up and provide this support. We've been able to support nearly every active grantee with some sort of support, the majority being smaller general support grants, general support not being something we're able to typically provide, and then a few program grants for other partners that we're working within the health system, given that much of our focus is on pregnancy to age 3 and integrating early childhood development as part of routine health service delivery. From this experience, I'd also like to join Jill in sharing a few of our reflections, which I think are very complementary. I think overall, we're all seeing how important it is to channel support to the front lines, namely parents and caregivers, but also to the health workers and community-based organizations that are there to support them. And when it comes to this work, it's clear that we can't, and I say we funders, I think it starts with us funders, can't afford to take a narrow view at this time. In seeking to promote the newer elements of the nurturing care framework, responsive caregiving, the early learning and play, we've had to step back and embrace the entire framework. And it's been very helpful to make the case to our board and internal leadership about supporting elements that we might typically not support, and broadening both funding parameters and partnerships to do so. So regarding parents and caregivers, I think we've heard great examples of how they're on the front lines and I think struggling to meet basic needs. I think Rupa painted a really compelling portrait of what it's like to live in an urban slum. We know that the food insecurity and hunger is immediate, and we know that it may also be longer term in many of the countries that we're supporting. We also know that COVID's exacerbated inequalities that have been there all along and underlined how important it is to understand the realities of people's lives and to design early childhood interventions that respond to those needs. How do we respond when basic needs, including access to food, is an issue? We found again that as a funder, we've had to reach out to explore new partnerships with people we don't normally work with, and we're exploring things like direct cash payments for basic needs and the challenges of doing so and how critical it is to work closely with CBOs in that effort where people may receive for a time-bound period cash support on their phones, as well as looking at support to women's groups that haven't typically been ECD partners to respond to the increases in gender-based violence. And again, all these elements contained within the nurturing care framework. COVID-19 response grants are enabling our partners to mitigate the multiple adverse impacts, including food insecurity, increased stress, and violence within the household. And we know, given the impacts of toxic stress, how critical that is. We're also looking to ensure we focus on equity and reaching the most vulnerable. One population we'd like to look further at are young mothers, a group often left behind and ill-prepared for parenting, and a group that we're hearing is growing given that teen pregnancies have spiked in many of the countries we're supporting given school closures and lockdown. When it comes to health workers, clearly our Thrive agenda has come based on child survival gains, and we will lose momentum if we don't continue to support child survival and maternal child health, HIV and AIDS, and we know that services have been disrupted. So supporting community health workers in their efforts to deliver nurturing care to vulnerable households is critical during this time. And we feel as an early childhood funder, we need to do our part to keep this workforce safe and to enable the integration of COVID prevention and care as part of that maternal child health and early childhood integrated package. And we're inspired by some of the digital platforms we're seeing integrating all of these elements. And we're also seeing that we need to continue to underline the critical need for universal health coverage that reaches those left behind, including those living with HIV and AIDS, and to do all this work really within the health system strengthening paradigm. Regarding community-based organizations, I think Rupa made a great point about how vulnerable they are. She said 30 to 60% may cease to exist given financial pressures. A clear lesson we've learned from the HIV and AIDS field is the need to preemptively scale up and support family resilience and care immediately, ideally before the virus takes hold. We know CBOs are well placed to deliver important prevention and destigmatization messages critical to government preparedness and response, and that they can reach the most vulnerable and underserved. It's often challenging as a funder making small grants to CBOs. I was impressed to hear from Jill that the Lego Foundation's been able to really scale up, sounds like a large number of these grants. The Hilton Foundation continues to be committed to expanding support to both larger local NGOs and CBOs, and we're pleased to support a new fund set up by the Firelight Foundation that is channeling COVID support to CBOs in East and Southern Africa. And finally, we're seeing that our joint advocacy efforts all together are going to be critical to ensuring that the momentum that we've been enjoying the last few years for early childhood is not lost, particularly given how impacted young children and caregivers are by the pandemic and the economic scenarios playing out in donor countries as well as lower and middle income countries alike. The motto to build back better is ringing out throughout all the land, and it's clear we need to be thinking long term as we strengthen the ECD movement, new partnerships and alliances that elevate the voices and experiences of parents and caregivers. So on that cautiously optimistic note, I'll stop here and look forward to the discussion. Thanks so much.
And your presentation was absolutely compelling, as we knew it would be. I had written down disparities have been exponentially worsened, which I think we all know, and are saying, I'm not trying to take anything away from any optimism, but we certainly know that. I love the broad view, the nurturing care network. And then I think, unfortunately, from a COVID perspective, we have to look at the immediate issues that we're all dealing with globally and also longer term. So thank you for what you're doing. So we have, first of all, I'd like to thank all of our speakers today. They are true leaders in this arena and doing wonderful things globally. So my sincere appreciation for you being with us today. So we have a few questions, and we have 8 minutes here. So just so you know, if you've asked a question and we don't get to it, and there will be some that we will not get to, we will actually ask our presenters to respond to those questions, and we will put it up online. So please don't be discouraged about not having your specific question answered. So I'm going to go, this is for all panelists, so here's the question. This listener said, I'm listening to this while watching my son do virtual school, wondering how we can continue to support our children and ourselves during this time. What words of support do you have to offer families in the middle of COVID? So what I'll do, since this is to all of us, and I mean, you could speak for a long time on that. You have spoken. You've actually addressed some of that in your presentations. But I would ask you, I'll make it a little bit shorter and say, if you could say one thing, if you could say one word, one sentence of support for our families, or one thought of support for families, what would you say? So I'll call you all out. So Rupa, what would you say to families, please?
I'd say to families and parents, be kind to yourselves. I think these are extraneous, situations, unprecedented situations, and don't be so hard on yourself. I think there will be instances where, things that you would have otherwise done differently are not working according to plan. But despite all the constraints, I'm sure parents are giving it their best shot, despite all the constraints and all the pressures on them. So I'd really like them to be kind to themselves.
Thank you, Rupa. Wonderful. Jill, how about what are some of your thoughts on this?
Well, I certainly echo that sentiment, and also that we are trying to learn as much as we can about best ways to support parents and caregivers during this time, and we'll hopefully be sharing all of that information as we can, but that we're really trying to learn more about the exact thing that you're experiencing and how to help families.
Yeah, thank you. Deborah?
Recognize that you are doing your best, and just have some patience with yourself, with your circumstance. I think I'm echoing what the other panelists have already said, but I think that deserves to be emphasized, that you are doing your best, and we all know that.
Thank you, Deborah. And Lisa?
Yeah, I think making time for yourself as a caregiver and remembering that despite things that aren't there for your child, love is what matters. And you're doing a great job, I'm sure, with that.
Wow. Wonderful. I think we could certainly end with those beautiful thoughts. Let me just see, we have several other excellent questions. We'll go for just one more here in the last 4 minutes. Great presentations. I'm pleased to see the inclusion of socio-emotional milestones. Are any of you, which I think we've heard from some of you, working with the school system? And I'll open it up to school system. This question was the school system, early childhood home visitors. But let's just talk about how you're working with schools to help during this time. Whether children are in school, are working, or have school virtually, and we can talk about internet and those kind of things. But let's just talk about how the interaction that you all have with schools. So we'll go the other way. How about Lisa? We'll start with you on that one.
Thanks. Our interactions are limited since we focus on birth to 3, but we are focusing on advocacy to ask governments and donors to allocate 10% of their education budget to support preschool and pre-primary.
Wonderful. Thank you. Yeah, the early childhood piece of that and the visitation is so critical. Thanks, Lisa. Deborah?
Currently, we are monitoring the situation to see what policies are being put into place for the return to schools, to develop a second framework that will support messages for caregivers and children that correspond to those policies. But most of the content that we've developed is for use within the homes, taking the restrictions, the lockdown restrictions that were in place. So that is in development now.
Thanks so much. And Rupa? Interactions with schools?
We are actually engaging with teachers. So one of the recurring concerns that we hear from parents is helping their child adapt to online lessons during this time, especially for the older children. This comes repeatedly in assessment sessions as a developmental pediatrician for me. So one of the things is also to help parents get ready to support their children as they attend online sessions. And also we have a school outreach team in our organization that works closely with teachers, because this is a huge shift for the teachers also. From classroom teaching to online teaching, it's a big shift that's happened overnight. To support, and they've been supporting schools and teachers through this time.
Great. Thank you so much. There are about 10 other wonderful questions, which we don't have the time to address. We're cognizant of the time, but what we'll do is get with our presenters and answer those questions. We'll share them and we'll follow up either by email and online. So stay tuned for that. The AAP continues to develop and update guidance on early childhood and education, particularly in the context of COVID. Please visit our website for additional details. And before we sign off, on behalf of the AAP and the AAP section on global health, I just want to thank our speakers once again. Absolutely remarkable. Such a privilege to hear it and to be with you, and to thank our co-sponsors, Umeed Child Development Center and the Hilton Foundation. Today's webinar will be archived on the Academy's YouTube channel, and you'll receive an email when it's been posted. My sincere thanks to all of you for being on this webinar, and particularly to the speakers.
Thank you so much.
Yeah. Thank you.
Thanks, everyone. Be safe and well.